So good afternoon, everyone. It's my pleasure to be with you. I was sharing with some of my colleagues that I've been asked to give presentations on One Health in the past, but it's usually a 3-hour presentation. And so I have to condense this in 15 minutes. So what I will do is really discuss some high-level, very broad topics to try to give you a feel for what we do at ARS. But, obviously there's other federal agencies. So within USDA, I probably will mention some other things. Joe Nelly, who works for APHIS, will also give a presentation, and we haven't coordinated. So hopefully I won't talk about anything that you were going to talk about, Joe. So let me see, which button do I use here? Okay. So just to put things in perspective, because today, inevitably everyone talked about One Health from their own context, their own interests. And we know that when the One Health movement started, it was essentially, very broad. And if you look at what the AVMA and MA produced, they have a long list which essentially will pretty much allow anyone to find something in the One Health movement that they can associate with. But for the context of this presentation, and especially agriculture, I think we're going to change gear a little bit. And I wanted to present this because I think for me, personally, this is what One Health is, or at least what I do for a living in terms of research in agriculture. And basically, this document, which was produced in 2010, is this tripartite concept note from FAO, the Food and Agriculture Organization, OIE, which is the World Animal Health Organization, and of course WHO. And essentially, they established One Health to be, in terms of what they thought was a mission, is a world capable of preventing, detecting, containing, eliminating, and responding to animal and public health risk attributable to zoonoses. And to me, that's a key word, focus on zoonotic disease and animal diseases with an impact on food security through multi-sectoral cooperation and strong partnership. So through my allotted time, which is 15 minutes, so I'll have to be very quick, I'd like to start off with some history and talk about some of the pioneers of One Health. Because I think One Health has been around for a very long time, and we have to remember this. It's not really anything new. And then I'll briefly talk about the importance of One Health in the context of animal agriculture, give you some information about Agricultural Research Service, and I'll touch base and maybe broader in terms of what USDA does. A couple slides on gaps and challenges. And since I have the podium, it's an opportunity for me to make a few recommendations. Not that I was asked to, but that's one way of sharing with you some of my thoughts in terms of some of the things that are needed to really enhance the role of veterinarians in biomedical research. So looking back at history, it's kind of interesting that when you think of Theobald Smith, who happened to be the assistant of Dr. Salmon, Theobald Smith, as many of you know, was the discoverer of Salmonella, and in fact, he gave the name, or to that pathogen, the name of his boss, which was at the time Dr. Salmon. And those are very, very interesting individuals. Again, an MD-DVM combination. But what's interesting is that Dr. Salmon was the first veterinarian to obtain a veterinary degree from the U.S. school, which happened to be Cornell. And importantly for me, Dr. Salmon was the first director of the Bureau of Animal Industry. And the Bureau of Animal Industry is the ancestor, if you will, of ARS, Agricultural Research Service, which is essentially started in 1862 with the creation by Abraham Lincoln of the Department of Agriculture. And it's very interesting that from the get-go, this Dr. Salmon of DVM and Theobald Smith and MD were working together. Now, one might wonder, why was a MD working for the Department of Agriculture, specifically the Bureau of Animal Industries, way back then? And as you know, many of the issues that we were facing in public health back then were sanitary issues. So back then it made a lot of sense. And there's certainly other MDs that have contributed to MD. Rudolf Virchow is certainly one of them, the founder of comparative pathology, which I understand you talked about quite extensively this morning, the father of modern pathology, and importantly, the person that coined the term zoonosis. And there's been a lot of, again, DVM, MD partnerships over the years. Certainly, this is one that is an important one. Jean-Marie Guérin and Albert Calmette, pioneers in tuberculosis research and the co-discoverers of the BCG vaccine. This gentleman right here, I think, is a very important individual in terms of the One Health movement, a graduate of my alma mater, but importantly, the father of what we call today veterinary epidemiology. And he was one of 8 founders of a school of medicine out in California. And importantly, he's the one that coined the term One Medicine. And over the years, we know that we've had a significant number of veterinarians that have made significant contributions to biomedical research. Certainly, De La Font with anthrax, Bang with brucellosis, again, Guerin with tuberculosis, hemolytic anemia, autoimmune hemolytic anemia, the test, Coombs, and Doherty in terms of immunology, which I believe is probably the only veterinarian that was ever awarded the Nobel Prize. So over the years, certainly veterinarians have made and will continue to make important contributions to One Health. Now, One Health and the importance of agriculture. FAO tells us that livestock, right, contribute up to 40% of the global value of agricultural outputs, and they support the livelihood and food security of almost 1 billion people. And recent studies have shown that research is really critical, and the return on the investment in terms of agricultural research is 20 to 1. Now, as we move into the 21st century, we know that one of the great challenges that we face is that we are predicting that we're going to have 9 billion people on this earth. And we're going to have to feed 9 billion people. And if we're going to do that with available resources, that means that we're going to have to double our output in terms of agricultural production. Now, I'm going to talk about funding in this presentation. It's inevitable. But one of the things is, if you look at the innovation and the progress that's been made in animal agriculture in the last 50 years, it's pretty tremendous, right? We've come to essentially increase the yields tremendously. And it hasn't been done by farming more land or farming more animals. It's been done by agricultural innovations, research, and practices that have essentially doubled the productivity of our livestock yields, our dairy cows, etc. And this growth in productivity has been attributed largely to investment in research and innovation. Interestingly, lately, there has been more and more of an investment by the private sector in agricultural research. So looking at my agency, which is the research branch of the Department of Agriculture, and I thought I would show this organogram because it's very important to make a few points that I want to make. One of the points that I want to make is when you look at the Department of Agriculture, does this pointer work? Yeah. Here it says Agricultural Research Service, and I want to make the point that Food and Safety and Inspection Service is an entirely different branch. And when you look at APHIS, our Action and Regulatory Agency, it's also in a different branch. Now, when I talked about the Bureau of Animal Industry way back in 1862, we used to all be together under this management unit. And one of the things that we have to understand, and it's a significant challenge as far as I'm concerned, is that we're one of the few countries that does not have a National Institute of Animal Health. So we have all these entities that are, separated, and yet we have to work across those demarcations, these different units, to somehow make this work. And it's very challenging. So within our Undersecretary for Research, Education, and Economics, another thing that's very different than here at the NIH. At the NIH, you know that we have both the intramural research branch right here on this campus, as well as the extramural branch. And in the USDA, those are separated. So our sister agency, the National Institute of Food and Agriculture, is our extramural research branch, and they're a totally different agency. So I just present that to make the point that it's, pretty challenging to try and coordinate this. And I will mention that both NEPA and ARS were just a $1 billion agency. And when you look at ARS specifically, we have 19 national programs, and animal health is just one of 19 national programs. When we started out, we were 100% animal. Today, the animal health program is only 6.2% of that program. So how do we get things done? How do we, do research? Well, the answer is we do it through a lot of collaborations, and I'll touch base on that in a few seconds. This represents the laboratories that conduct animal health research, and for the, because we're limited in time, I just want you to focus on those that are in black and have an asterisk. These laboratories, one being Plum Island, another one being in Ames, Iowa, our National Animal Disease Center, Manhattan, Kansas. These are where we conduct our biodefense research program, and this is where we have our high containment laboratories. And the definition of biodefense research, which within the federal government, as you know, cross-cuts, Health and Human Services, the Department of Defense, Department of State, et cetera. The definition is defensive measures taken against outbreaks caused by pathogens, whether they're natural, unintentional, or intentional. But for us at USDA, it's all about global food security. So what are the threats? What you see before you is a list of 17 diseases that we at USDA decided that we were going to focus on. And you'll notice that a lot of these diseases have an asterisk, and those are all zoonotic diseases. So a substantial number of those diseases that we prioritize are in fact zoonotic diseases. Now USDA, specifically APHIS, has tiered those diseases into 3 tiers. And just looking at tier 1 diseases, you'll recognize foot and mouth disease, which happens to be D1, tier 1 select agent, one of the most feared disease that we certainly don't want in the U.S. But we also have this avian influenza, right, which is, again, an important potential zoonotic disease that has an animal reservoir. So for our research program, those diseases, and I could have used, examples to get in detail, I don't have time, those are the drivers of our research programs, that deal with biodefense. Now, that's a nice list, but when you look at the OIE list of reportable diseases, those 3-tier diseases only scratch the surface, right? We have all these other diseases. And when one looks at emerging diseases, both on the human side and animal side, how do we prepare for this? And again, you'll see with an asterisk, a significant number of these diseases are in fact zoonotic diseases. One of them, pandemic H1N1, in the agricultural side, we like to call that a reverse zoonosis, because actually our pig did get infected with pandemic H1N1, but they got infected from humans. So what are some of the gaps and challenges? There's lots of them, but because my interest is agriculture, I'll touch base on 2. The first one being food animals. So one of the key challenges that we have is we have a critical need for veterinary scientists in food animal medicine. Most of you today and most of the discussion has been around biomedical research, human health research, but right now we have to realize that these food animals are very important, both from an agricultural standpoint, but also from a public health standpoint. And one of the challenges that we have, as I mentioned, that NEPA, which is a $1 billion agency, their competitive grant program is basically, it's ranged from $7 to $12 million. So if you imagine $7 to $12 million for 28 veterinary schools, right, that's not going to go around, very far, which means that a lot of our veterinary schools are in fact working on human health disease problems. So on the agricultural side, it's very challenging because the funding and available funds is really dire. So in terms of veterinary scientists and the tasks and the challenges that we have, we really need more veterinary scientists. When we look at FAO and OIE, many of you know that we have now eradicated rinderpest, the second disease eradicated by men on the face of the earth. And there's a need and a look and an endeavor to actually have more of a global view in terms of the control and eradication of some of these priority diseases. And in the agricultural side, we're establishing a lot of research collaborations. Because of the lack of funding, we've established things like the GFRA. If you Google the GFRA, you'll see that's a Global Foot and Mouth Disease Research Alliance, whereby we're taking scientists all over the world and we are aligning our resources around key objectives. Certainly, new vaccines that are designed for control and eradication is going to be a key research endeavor. And surprisingly, you may be surprised that on the veterinary side, we're actually far more advanced in our development and research of vaccines than you are on the human side. Not that we're any smarter, but the reason is, as you know, is we have the animal models. So we're able to test directly in a relevant host the actual disease to see whether drugs and medicines are actually effective. So we're really going to need more veterinary scientists to cover these areas, and we also need more access to large animal research facilities. And so there's going to be this critical need for veterinary scientists in the government. And I will mention, when you look at all USDA veterinarians, only 1.8% of those veterinarians are conducting research. So there's a significant gap of veterinary scientists in animal agricultural research. So for the many veterinary schools that are here represented today, we're going to, in fact, need more DVM PhDs to take on careers in this important area. The other gap and challenge, of course, is public health. A large majority of new and emerging diseases, as I mentioned, are zoonotic. You pretty much discussed this today. There's a lot of need, a lot of gaps, both in laboratory animal medicine, the need for animal models for human medicine. I know that I'm preaching to the choir, so I'll stop right here. So let me end with some recommendations for enhancing the role of veterinarians in biomedical research. So one of them, as far as I'm concerned, is we need to provide support for integrated research programs that target both animal health and human health aspects of zoonotic disease. So if we look at an Ebola outbreak, if we look at the concerns with MERS-CoV in Saudi Arabia, as you know, those lines of demarcations are real. But if we're really to control these diseases, we know that we're going to do a lot better to essentially integrate both surveillance, understanding these host reservoir. I mean, let's face it, with all the investment and concern with MERS-CoV, we still are not quite sure about the animal reservoir. So this would be an area that can have a tremendous impact if we can have more integration of those research programs. And the important thing that's already been discussed throughout the day today is to provide funding for cross-training veterinarians and physicians in integrated research program. And I'm very pleased to see that we're seeing more and more universities like UPenn that have integrated programs whereby they'll take their graduate veterinarians and their graduate medical doctors and train them together to go through a PhD program. And I think that's very advantageous. So on the veterinary side, we tend to have, as we saw this morning, some co-DVM PhDs. It's very challenging to do that. But, and it's very challenging for veterinarians because the average age of a veterinarian that graduates in the United States is 28 years old. So who is going to be willing to yet undertake another 6-7 years? And one of the differences that we have is like the NIH will take a medical doctor and allow them to train him through a postdoctoral fellowship right here at the NIH. At USDA, like in my agency, we have a total of 40 veterinarians, and the requirements are that they have a PhD. So personally, as a DVM PhD, I'm not hired for my veterinary degree. I'm hired for that PhD. So we really need to look at that training. It's going to be very critical going forward. Another thing that I like to emphasize is support scientists versus primary investigators. We have a lot of veterinarians right here at the NIH that are support scientists, and that's very important, a very critical role, and certainly one that's searched by the biomedical community. But we also need to build veterinarians as primary scientists, and we don't have enough of these. In large part, as I mentioned, because we don't have enough DVM PhDs. But if you think about it, the veterinary degree and the background, and for those of you that are DVM PhDs in the room, what a tremendous background for obtaining a PhD and taking on a career in biomedical research or what have you, in terms of primary scientist. A very powerful combination. And so to me, this is a key challenge, and we need to do much better in terms of getting more veterinarians to be primary investigators of research, whether at the NIH or ARS or other places. Another thing that's going to be important is I think One Health provides all sorts of opportunities for threat reduction, for the reasons that I've listed here. Whether we're looking at joint medical veterinary education programs, integrated zoonotic disease surveillance program, funding a veterinary public health program, integrated epidemiological investigations, integrated biomedical and animal health research, or we now know that the president has established CARD, right, combating antimicrobial resistance. That's a key. We're about to lose one of the most important, along with vaccine, medical tool that we have to treat diseases. And so when we look at antimicrobial resistance, when we look at the generation of alternative strategies for treating and preventing diseases, that's going to be critical. And the more we can integrate that effort throughout the federal government, the better or the higher the likelihood that we're going to derive some solutions. And all of these are going to require a One Health approach. So in terms of this is my last slide in terms of recommendations, I'd like to recommend to whoever would like to listen that we really need to support postgraduate training programs to increase the number of veterinarians with DVM PhD degrees. We need to provide resources for recruiting, training, retaining veterinary scientists in animal health research. We need to increase animal health research programs that support global food security and disease control initiatives. And lastly, increase the participation of veterinary scientists in One World, One Health initiative. This slide here is NBAF, the National Bio and Agro Defense Facility, a facility that the Department of Homeland Security is building and will be available to us in 2022. And this will be the first BSL-4 large animal facility that we have available in this country. Other countries have them, we don't. And that's going to provide a great incentive to build that infrastructure, to build those research programs that we'll need not only for our biodefense research programs, but to put us in a better position in terms of global health security. With that, I thank you very much for your attention, and I'll turn over the floor to Dr. John F.
Thank you, Cyril. That was outstanding. Appreciate that. I didn't talk to Cyril before we started, but I did see a copy of his presentation, and I knew that that was going to fit in perfectly ahead of mine. One of the things that is a challenge about One Health is that it really is so encompassing that it's difficult to try and figure out exactly what you're going to do that is a One Health sort of project. And one of the sort of mantras that I've been using about this is that the epitome of One Health is saying, I don't know what I don't know. So when I have this difficult or wicked problem in front of me, I need to bring together a multidisciplinary group of folks and address the problem and find out who within those multiple disciplines have something that can contribute to the solution of that problem, and then work from there. So developing a One Health initiative for me in USDA, and APHIS is the Animal and Plant Health Inspection Service, was to figure out just what is One Health to us and what are the networks that we need to bring together to develop a One Health program. This is very similar to the slide that Cyril presented, and I'm using it for almost the same reason. We've got the Animal and Plant Health Inspection Service over here within the Department of Agriculture, and as he pointed out, many connecting organizations throughout a very large department that ordinarily have worked within our stovepipes. So the the definition of bureaucracy, when it was considered a positive thing, was that we focused on our own specific area of expertise, and that way we weren't sort of distracted by all of these other different areas. Well, now the challenge is that we've focused in these stovepipes so much that we need information from other parts, not only of USDA, but other parts of the federal government, private sector, et cetera, so that we need to figure out these connections. And by the way, Cyril, with his excellent history lesson, reminded me I should probably point this out. One of the things that we see as confusing today is the distinction between what our Food Safety and Inspection Service within USDA does and what the Food and Drug Administration does. I mean, it gets down to the point with how much pepperoni is on the pizza as to who regulates that product. The reality is when the Food and Drug Administration was first started, it was placed within the Department of Agriculture. It was a reorganization in the 1930s that separated out only some into a separate entity, remaining with some of it remaining back in USDA, and then here we are, almost 100 years later, trying to struggle with how do we network and how do we look at who has the authority or regulations over certain things. So our challenge within the Department of Agriculture around One Health was how do we pull this diagram together around that human-animal environmental interface. And what we did was we developed a USDA-wide One Health joint working group. That joint working group is coordinated at a multi-agency level by the undersecretaries of Food Safety, Marketing and Regulatory Programs, and Research, Education, and Economics. This group is then co-chaired by deputy administrators in each of those organizations, so FSIS, APHIS, and ARS. And then beyond that, a large number of agencies within the department are all members of this USDA One Health Joint Working Group. So when we have common issues that we need to work on, we can work them across what are kind of our artificial stovepipes that we've put ourselves into and be able to address problems in a more multi-sectoral approach. The other thing we had a challenge with is when we say we're going to do One Health, what does that mean? I mean, it's so broad, it could be so encompassing. How do we narrow that down to be a few things that we can actually focus on? So what we did was we looked at the broad landscape and decided that for the kinds of expertise that we have within USDA, we would focus in these primary areas: zoonotic disease engagement, pre-harvest food safety, antimicrobial resistance, animal and pandemic influenza preparedness, and global health security. Now, before I go another step on this, and I'm going to talk a little bit about what we do in each of these areas, something that as researchers I'd like you to understand is that APHIS has a nationwide network of veterinarians and animal health technicians that are on farms in every county in the United States. When we have a perplexing problem of needing a new diagnostic test, for example, for some newly emerged disease, we turn to our primary sister agency in ARS and we present them what our challenge is, and they do research to develop some answers for us, either a new diagnostic test or a new vaccine or something that would help us solve our problem. I'd like to turn that model around a little bit here to say, as researchers in any field of endeavor, if there are animal models and on-farm models that might be useful to you either in collecting data, collecting samples, doing ongoing longitudinal studies, we may very well be able to partner with you to accomplish those sorts of things. We do some of them internally with our National Animal Health Monitoring programs, but certainly in some areas of, and I'll get to it here later with pandemic influenza, there are certainly some things that we've been working on together already with NIH researchers on influenza vaccines on both the human and animal side. But we'll go into some of these, and I'll start with zoonotic diseases. You know that influenza A in swine has been around for a very long time. It doesn't really cause any problems for the pigs. It's a management disease. Pigs will sniffle a little bit. They'll go off feed a little bit. If it becomes a serious problem, there will be an autogenous vaccine that will be produced that the veterinarian will use in that herd. But the challenge was, after the 2009 H1N1 human influenza pandemic, the matrix gene of the human virus seemed to have been injected into and reproduced with the swine influenza virus, so that swine influenza virus was now apparently more easily transmitted to people. So what we ended up with a couple of years ago at county fairs where people were showing pigs is one of those pigs would show up with the influenza virus. It would spread to naive pigs. We'd have a viral load that people would inhale, and we had kids primarily getting sick at these fairs with influenza virus, and we worked very closely with CDC. Unfortunately, in many cases, CDC was identifying the human case first, so we were using people as sentinels for the animal disease. But, we didn't quite get that turned around quick enough to be able to identify where the swine disease was first and be able to prevent transmission back into people. But we did at least get a much better understanding because of our partnership with how influenza viruses are transmitted between people and pigs. And there's a lot more known about the genome of these viruses now. Also, CDC, working with us, providing us funds they've received for human influenza, have asked us to do a swine influenza survey for them so that the more they can understand the change of the virus in pigs, the better able they will be to predict what the next seasonal circulating influenza might be. So we have a wonderful partnership with the CDC on this One Health arena just in influenza and zoonotic diseases. Another one that was a bit strange for us was salmonella in bearded dragons. We're the Department of Agriculture. Do we work on bearded dragons? Now we do. Under our new One Health approach, what we've said is that we don't just do livestock anymore. We do any animal that has this interface at the human-animal interface, and that we don't just do programmed diseases, but we will do any disease that's affecting the human and animal connection. So we were involved with CDC again on a joint multi-state investigation of a salmonella outbreak associated with bearded dragons. Another one is Mycobacterium murium. I believe this was New York City, yes, where fish handlers were beginning to get sick, and we were called in. We have an aquaculture section that worked with CDC and the New York City Public Health Department to look at the situation here. The other thing that we're working on is a field guide for how we would do joint epi investigations on zoonotic diseases. It's very similar to our foreign animal, the FAD, foreign animal disease investigations, but because of HIPAA rules and so on, the ability to trace back, for example, from somebody with a diagnosed case of bovine tuberculosis, we actually had a situation where we wanted to trace back from the human infection to the possibility of exposing dairy herds and find out whether or not there was a case of bovine tuberculosis introduced into the dairy from the human. Very difficult issues in terms of people would know immediately who the individual was who'd left that dairy and why we were back there to do an investigation. So it's very difficult. We've still got to work through a number of those issues so that this One Health approach at a field level can still go forward. And then there's another tool which I think we can also offer you if you want to contact me later. It's called the One Health Collaborations Method. We're doing a course, but it's called OSMART, One Health Systems Mapping and Analysis Resource Tool. Yeah, but it's spelled smart, so it seemed like the right thing to do. So this thing is a way of using the Six Sigma approach to bring together a multidisciplinary team and literally map out how they currently work on a problem, and if they were to apply a One Health approach, how would their ideal solution to those problems be? What would the networking be? What would the communication lines be? And so on. And at the end of going through this process, they will develop for themselves a strategic plan for implementing One Health within their, whether it's an organization, a state, or whatever. So the next one is pre-harvest food safety. I'll pick this up a little bit. You kind of get the idea of what we're doing here. We're working with our Center for Veterinary Biologics to produce a conditionally licensed vaccine for E. coli 0157, and looking at whether in field conditions that actually reduces the shedding of the organism, and whether or not it reduces it significantly to really make a difference at the back end of that, where a human is then exposed to the bacteria. We've also begun offering Salmonella enteritidis testing based on the FDA rule at our laboratories. And some of the other activities for our role is we are working with the Food Safety and Inspection Service and with producers, so that if there is an unusual case of a foodborne illness where the intervention strategies at a slaughter plant didn't seem to be sufficient to eliminate the possibility of this foodborne outbreak, we could, at the producer's agreement, do an epi investigation on the farm to see if there were on-farm practices that might have reduced the burden of bacteria going into the slaughter plant and thereby reduced the likelihood of foodborne outbreak for people. We're looking at some NOM studies to look at on-farm prevalence of diseases and look at risk factors associated with those foodborne outbreaks. And also looking at, and this is a whole separate area of antimicrobial resistance, but trying to describe what the on-farm antimicrobial usage is and how that may or may not move to resistant factors. So we're looking to advance these One Health priorities and now focusing on antimicrobial resistance. Something that Cyril mentioned was that there is this CARB, countering antibiological CARB, C-A-R-B, countering antibiotic-resistant bacteria. The president's initiative to do that brought a lot of attention to looking at antimicrobial resistance. And from the agricultural side, what we see is that there is really not a lot of solid data about the drivers for antibiotic resistance on the farm. And we need to gather more and more of that data. So our focus here is to gather that data to see what the drivers for resistance actually are. And the way we're looking to approach that is to slow the emergence and prevent the spread of resistant infections, to strengthen the national One Health surveillance effort to combat resistance, advance the development and use of rapid and innovative diagnostic tests to identify and characterize resistant bacteria, to accelerate basic and applied research and development of new antibiotics, therapeutics, and vaccines, and to improve international collaboration and capacity for antibiotic resistance prevention, surveillance, control, research, and development. So then looking at the next one for pandemic influenza and our engagement there is a group which is the Department of Homeland Security, the Department of Health and Human Services, ASPR, Assistant Secretary for Preparedness and Response, CDC, State Department, and we are working with Mexico and Canada. This came as a result of the H1N1 influenza pandemic, and we looked at other issues like avian origin viruses of H5N1, and in China, the H7N9, and the swine origin viruses listed on the other side, and are working together on how we could both identify these viruses, how we can characterize them to see what the next emerging human pandemic may be, and also share information so that we can protect North America by early identification. And as you may have heard, there are a number of high-path avian influenza outbreaks in North America currently. I don't know what has changed It appears that these influenza viruses that are highly pathogenic in chickens are surviving better in wildlife. So wildlife may very well be the cause of the spread here, originally through flyways, perhaps on the West Coast. And it has spread throughout most of the country, not the East yet. I would expect that we will eventually have outbreaks there, but we do have a program that looks for and will immediately depopulate any H5 or H7 influenza viruses, whether they're high path or low path. So we are currently working on that, but this may be the new normal into the future here if these viruses have adapted to wildlife and can be more easily spread now over long distances. The other interesting thing is that I think for every one of these, they are a point source introduction, and there has not been neighboring spread. So this apparently is dropping into an individual farm, and it's being eliminated before it moves laterally in the neighborhood, which leads more credence to the idea that waterfowl are involved in this. And then global health security, I don't know how much of this any of you have been engaged in, but it is the combination of multiple human health activities and the zoonotic diseases and animal health components. There are 11 action packages. This originally pulled together things like the President's emergency plan for AIDS and coordinated integrated approaches to all of these things. The 11 action packages can be found on the internet, and you can look at those for One Health kinds of approaches. And then finally, within veterinary services, our mission is now, as a recognized animal health leader and trusted partner, veterinary services safeguards the health of animals, people, and the environment. So our mission is essentially the One Health mission. I'll leave it there. Thank you.